Hello everyone, welcome back to yet another video on the Myofunctional Appliance series. So this will be about lip bumper, also called lip plumper. So this is available as a removable and also a fixed appliance. Fixed as in this appliance, it is soldered on the molar bands. Okay, we all know the myofunctional appliance application and force elimination. So does the lip bumper. So as we move ahead with the video, we'll discuss the modus operandi of it. First, we'll discuss the uses. So we know this is most commonly used in patients who have lower lip sucking habit. So this device, it acts as a barrier. This acts as a barrier between the lip and teeth. So because of which they have difficulty biting their lips. What happens is when children are constantly biting lower lip, they are pushing this force on the lower incisors, and because of which these incisors they get tilted and develop class 2. So which is why we use this lower lip appliance. Sorry for the disturbance. Second, it is also used in patients with hyperactive mentalis activity, again class 2 patients, that is lip trap. So what happens is, as they are constantly biting lower lip, it applies pressure on the lower incisors and also on the lingual aspect of the upper incisors. If you can visualize, or if you bite on your lower lip, you will get an idea. Thus, this causes flaring or of upper incisors, that is increase in overjet. So this is the device. This is the schematic diagram of lip bumper, and you must draw this in exam. So this is the device. This is acrylic sheet that we place between the teeth and lower lip. And what this causes is it eliminates the forces of lower lip, that is force elimination. So this acrylic pad is acting as a barrier and it is separating the forces. So no forces acting on teeth, and the tongue forces are up now applying force on these lower teeth. So thus they won't retrude, they won't move towards the tongue side. And also it is a kind of distalizing molars, so it is also used in distalization. If you can remember, we discussed this in the chapter space regaining procedures. So thus lip bumper is placed in this lower vestibule. Okay, so there's this one more den holes appliance which is given in the upper arch. So yeah, they will usually examiners ask this in viva. Thus the lip bumper, it helps to keep lower lip away from the lower incisors. So it is breaking the hyperactive mentalis activity, also breaking lip trap. And the tongue forces, they move they move lower incisors towards the labial side. Third use is, it is used as anchorage, augmenting anchorage. So this prevents forward movement of the first molar. And like I said, distalization or uprighting. Say if the molar is mesially tilted and like not upright, so or we need some space in here, so we'll use this as a distalization or space regaining device. So this will distalize molar, or at least cause it to be get upright. Okay, so if it is mesially tilted. And now modification. So we have this den holes appliance which is used in maxillary arch. Greenfield's modification. Now this is used in hyperdivergent cases. Here the distal end of U, okay, this is the mesial end towards the mesial side, and this is the distal end. So here this is kept longer than the mesial, and this U loop is important because it helps in adjustment, like on how to tilt this, or move it distally. So then we have modified lip bumper. It is supported on upper molars. Now here in the lip bumper, traditional lip bumper which we read, here the bands are placed on the lower molars, but in the modified lip bumper, these bands are supported on upper molars, and these lip shields, they are placed in the lower vestibule. Now the distal forces are applied on the upper molars. Here the distal forces are applied on the lower molars, but in the modified lip bumper the distal forces are applied on upper molars. So usually this acrylic pad, you see, it is placed C to C, that is from canine to canine. And yeah, this is the appliance design. Okay, so first the permanent first molars are banded, Then the impression is taken in PO and casted in POP, plaster of Paris, and 1 mm hard stainless steel wire is adapted from molar to molar. Then U loop is created mesial to molar. Now these U loops, the legs of these loops are made of equal length, that is 5 mm, and 2 to 3 mm wax spacer replaced in the anterior region, and acrylic pores is poured to make it lip shield. Acrylic extends from canine to canine. Now one more advantage is, because of this wire also, cheeks are getting separated. Okay, so this is important. Because of this wire, the cheeks are also getting separated, because of which the periosteum, the tissue over the bone, is also getting stretched. So this is causing passive expansion, just like Frankel applicator or Frankel appliance. And also, because of this appliance, this lip is getting separated. Again, the periosteum is getting stretched outwards. So again, this leads to bone remodeling or bone formation. So it kind of helps in class 2 cases. So that was all about lip bumper. I hope you found this video useful. Thank you for watching.